Thank you for the opportunity to speak with you. Karen, I may never forgive you for asking me to come up here after that presentation. Just saying. But as Michael has said, I suppose my talk is in the context of the palliative care policy, which was published in September of 2024, with the main goal of achieving universal access to palliative care. And it's quite a significant goal in that I mean that all persons with life-limiting conditions will have access to high-quality, person-centred, effective palliative care, irrespective of financial status. And the policy is underpinned by 4 strategic objectives with regard to the provision of the right care in the right place and time by the right people and with good governance. And it outlines 25 recommendations and 104 activities necessary to achieve that goal and those 4 strategic objectives. 91 of those activities are under the remit of the HSE, including the National Clinical Programme for Palliative Care, which I currently work with, and the Office of the National Lead for Palliative Care. And an iterative approach is being applied to the implementation of the policy, in that it will be implemented in cycles, and the 25 to 26 implementation plan will see the initiation of 65 of those 91 HSE-owned activities. And that equates to 71% of the HSE-owned activities. But each activity may have more than one deliverable and one time frame for achievement of that deliverable. So there's 113 deliverables outlined in the 25 to 26 implementation plan. So no small task and huge ambition is outlined in this implementation plan. The policy implementation group, chaired by Anne Cosgrove, the Irish IHA manager for the West and Northwest of Ireland, has been stood up. And this group, with the unfortunate acronym of PIG, is required to deliver on the implementation plan and will report to the Department of Health's oversight group, who will monitor the overall implementation. And involved in that is the provision of quarterly status reports, which are brag rated, which I'll explain a little bit more in a minute. The implementation plan, I suppose, because of the interdependency of many of the activities, they've been grouped into 5 work streams. And each work stream is outlined in detail, including the objectives, activities, and timeframe deliverables within the implementation plan. And the rest of my talk is going to really speak about the education, training, and research work stream. So we're all here. So clearly, that activity of developing a national palliative care education network under the chairmanship of Professor Connolly as a community of practice has been established. And really what it's trying to do is bring clinicians and educators together to promote the national organisation and delivery of palliative care education through a community of practice and through further collaboration. Furthermore, there's quite an ambition to develop academic departments in palliative care services and university settings by expanding faculty capacity and capability. To increase student placements, so each specialist palliative care service provider is going to be asked to do a mapping exercise of current student placements available within their service across all disciplines, to identify the barriers and enablers to facilitate student placements, and then to agree with their higher education institute an agreed number of placements going forward. Additional funding is anticipated for the provision of courses for GPs and primary care staff, and indeed a modular version of the ICGP course that was established in 2020 with the support of the IHF and the HSE will shortly be launched. Initially, or additionally, there's the intention to increase GP placements with specialist palliative care services. Specialist palliative care services are being asked to share leadership opportunities and to release staff to attend those leadership training and practice development opportunities. as a core pillar of palliative care, communication is at the heart of some of the activities within the policy, and the Irish Hospice Foundation is doing huge work with that regard. The CARO programme has disseminated and initiated a number of workshops with regard to promotion of advanced care planning, and 230 staff have already attended 12 workshops relating to the nursing home sector. 156 staff have attended final journalist training in the paediatric setting. This is all with regard to by quarter 2 of 2025. And 626 staff have attended final journalist training in 20 hospitals. As a resource to communication, the What to Expect booklet and the palliative care booklet have been translated into 6 languages, and they're available on the IIHF website. And 2 new workshops relating to doctors and practitioners, practical language and phrases have been initiated with attendance of 157 at workshop 1 and 55 at workshop 2. I hope everybody in the room is aware of the National Healthcare Communication Programme and the 11 excellent modules, but I'd particularly highlight the end-of-life care module and its availability and swathe of resources that are available through the National Healthcare Communication Programme. They also have an excellent graphic novel with regard to end-of-life conversations that they've disseminated on their website, and it really supports preparation for the initiation, the conduct of end-of-life conversations. In terms of the CARO programme, a quality improvement project for nursing home sector, the aim in 2025 is that 144 new nursing homes will have signed up to the CARO programme, and by quarter 2, 33 new nursing homes had been recruited. 186 CARO death reviews had been completed, and 9 ECHO networks were operational, and nearly 2,400 people had participated in those. And that goes back to the point earlier in terms of those ECHOs are trying to bring your local specialist palliative care service as a hub of knowledge together with all of the other providers in primary care and nursing home sectors to try and create that collaboration and that local knowledge and connection. In terms of I suppose, in terms of trying to ensure that research does reach practice and impacts on policy, the importance of developing a knowledge management framework has been highlighted in the policy, and a first step is to commission a scoping review to identify the international literature with regard to the key elements of a knowledge management framework, and then to map what are the current infrastructure, funding and resources available within Ireland, with the intention of then tendering for the development and maintenance of a knowledge management framework. There's the intention to create regional specialist palliative care education and research centres that are fully coordinated partnerships between the specialist palliative care service and their partner universities, and also to develop further clinical academic posts with contractual remit with regard to clinical service, research and education at a minimum, that within each integrated palliative care network, you'll have a professor of palliative medicine, a professor in palliative care, and adequate staffing to support student placements. The second iteration of the implementation plan for the policies in 2027 to 28, there is further intention to review undergraduate palliative care education, but first the palliative care competency framework, and we're lucky enough to have Professor Connolly to chair that work as well. And that will inform and support the further development of undergraduate curriculum. The final version of the UCD evaluation of the CARO programme will be completed. And furthermore, a strategic review of palliative care education, research and innovation, capacity, capability and performance will be completed to further inform the ongoing implementation of the policy. I mentioned the brag rating earlier of the quarterly reports, and really what that means is if an activity has been completed, I'm just highlighting that if it's in blue colour coding from the brag status update, it means it's completed. and there was an activity with regard to training for central line use and care for children and adults, and a significant compendium of training resources related to central venous access devices has been shared and disseminated through the Specialist Palliative Care Provider Network. There was an activity to revise the e-learning programme for palliative care needs assessment. That work has been completed and launched with the support of the All Ireland Institute as part of Palliative Care Week in September of 2024, and thankfully has been received well, and 5,600 people have completed the e-learning programme to date. Furthermore, the education and bereavement database from the All Ireland Institute has been significantly reviewed and updated and further disseminated so that palliative care education courses are accessible to when required. And going back to that question of the key drivers of education, who or what are the key drivers? And I suppose my key message would be every single one of us in the room. We need to go back. There's lofty ambitions in the policy. There's a lot of money required to fulfil those ambitions. So we need to go back to our regions and agitate, nag, cajole, encourage, champion the provision of education, training and research within palliative care and the resources and funding required to support that. Look forward to your questions.
So, anyone have a question for Martina? And just have a mic or a comment, question. Regina? Just wait for the moment. Just one second.
Thanks very much, Martina. Just maybe a couple of comment or questions. One is in relation to the education and then the evaluation of it. So I'm very pleased that there's going to be a very good evaluation done of the CARU project. And I know there have been other education projects done before without such clear evaluation. But that CARU project, I presume it runs a certain time, gets evaluated, and then there's a decision made whether to fund it in the future or not. Is that the plan? That's one question. And
there's a midway and a final evaluation, so it's a continuous evaluation as the programme is being delivered, and I think we await the final recommendations of that evaluation as regards further funding.
Okay, but is it likely, if the evaluation says this hasn't made much of a difference, despite everyone thinking it's lovely, is it going to then not be continuing, or do we know how the approach is?
I couldn't anticipate the outcome of the evaluation, Regina,
okay.
So I can't.
I know, no, it's not about the outcome, but it was just about potential outcomes. Yeah. Okay, all right.
I think we'll await the evaluation.
Okay. I suppose the other thing is the first speaker just talked about the fact that in Toronto, a lot of palliative care is basically delivered by specialist palliative care. In reality, in Ireland, that's also the case. Are there ways of trying to improve the sort of education to provide better palliative care approach and general palliative care? Because although that's in the competence framework and although it's in the policy, in reality, nobody in Ireland thinks they've got palliative care unless they've seen specialist palliative care. Is there any way of, is that how that might be? And like maybe there are other parts, but like in Dublin they don't.
Well, I think part of the work is the revision of the palliative care competency framework, and then the next step is the implementation plan with regard to that palliative care competency framework and trying to embed those core competencies in undergraduate and postgraduate curriculum for all disciplines. And that is a huge ambition, but we need to start somewhere. I think the palliative care competency framework can also be used with regard to kind of succession planning within organisations, within job descriptions, within interviews. So it's only by kind of asking people to meet those competencies. But I suppose one of the other work streams within the palliative care policy is around communication and community involvement, and that piece around compassionate communities and knowledge and awareness of what is palliative care, that it isn't just at end of life, that the benefits of early integration of palliative care, that is interspersed throughout all of that work stream.